Thanks everybody for coming. This is, of course, the semi-finalist round of the Prime Health Innovation Challenge, our California edition. So beyond all of the great companies on this call, we also have our friends from the California Healthcare Foundation who are here as well. And so we'll get to hear from them and learn more about what they're doing and various programs that they have. But really the point of today is to dive into, we call this our Innovation Academy, and really what it's all about is helping to build a common language and baseline and foundation for working within safety net healthcare. At least in my experience in the startup world, we focused a lot on working with like the large, innovative academic medical center type health systems. And by way of background, I should share that I co-founded Redox, which is a digital health company in the space about a decade ago now, and left there this summer. And our entry into the market was really with larger health systems, with groups that had innovation teams and money set aside and structures set aside to figure out how to work with innovative startups, which left really where the majority of healthcare happens in the safety nets on the sidelines, which is unfortunate because that's so often where they're left. And so one of the big goals of Prime Health is to try to bring them into the forefront of innovation in healthcare and really help the innovation community, including all of the startups, investors, people like that, focused on how do we actually do right by the most sensitive parts of our population, the frequently underprivileged and folks that don't have a lot of the access and funds to be innovative. And so that's what today is all about. And we're going to hear from a number of different speakers and have different angles of it. So this is our agenda for the day. So we'll spend this first hour getting to know each other a little bit. So everyone here will have an opportunity to say hi and speak. We're going to do some breakout groups so we can meet people at a little more deeper level. We'll hear more about Prime Health and more about the program itself and where we're at in the program. Then after that, we're going to go into the culture and common pitfalls within the space. So what we've often seen is coming from the startup, tech startup culture, and that culture colliding with the culture of safety net. That can be interesting. And so we're going to talk a little bit about that and how to actually best work within those environments. And we'll get to hear from Carlos, who's the founder of Rubicon MD, a really great successful company in the space, and how he specifically navigated these cultural differences. We'll have a little break there. Then we're going to dive into the Healthcare Safety Net 101. And this is just sort of setting the groundwork for what are the different aspects of the safety net? What are programs that are involved? How does Medicaid work? How does Medicare work? These sorts of things. Then getting paid in Medicaid. I love that rhyme. I actually did a podcast with Rachel, who was the prior CEO of Prime Health, called Getting Paid in Medicaid. And it really focuses on the different drivers that these Medicaid providers and the payer itself are focused on. And that will also be with a guest speaker interview style. We'll take a break for lunch. During lunch, we'll have your dietary preferences will be honored because you're feeding yourself. So we're not providing lunch on Zoom, so you figure that out. And then we'll go into the California healthcare landscape and talk specifically about what's going on in California and where you might be able to plug into that, which should really inform some of the next steps for you as a participant in the challenge program. So I want to do a quick overview of the challenge itself. We've been doing this for 10 years now, which is amazing to me. And when I say we, I mean Prime Health, which has been Darby primarily, but also other folks throughout the years. Through this process, we've worked with 500 different innovative solutions. So these are mostly startups in the space. funded 45 different pilots. And the way I think about the challenge is it's really matching supply and demand. You all are the supply. You're supplying your great new ideas and products and solutions in the market. Demand is the health system side, and we try to help match those things. So similarly, on the health system side, on the demand side, we work with them to find, what are the challenges that they're looking at to help inform what solutions we put in front of them during this challenge process. And so when those two come together, that typically happens through a pilot, and the funding that Prime Health has been awarded through the California Healthcare Foundation is really to fund those pilots, to enable not only you as a startup to generate revenue from the pilot, but also fund the costly activities that provider organizations have to go through to actually adopt a new piece of technology. There's tons of change management that's involved in that, training. There could be disruption to their typical flow of work that isn't often accounted for in the cost of innovation. And so we want to ensure that is accounted for and able to fund that through this process. All of that with the goal that initial pilot turns into evidence for you as a startup that you can take and bake into how you sell your product, how you market it, as well as a lasting customer that you can develop a deep relationship with and hopefully deliver the value that you have in the vision of your product on the long term. So we are right now in the semi-finalist round. We call it the Sweet 16. We, pepper the country with marketing to get applications of tons of startups, and we've whittled it down to the 16. And as part of this process, we're doing the Innovation Academy, which is happening as we speak. And then we are also opening up office hours. So this is, to basically move into the final round, right? You fill out an application that talks more about your business and your traction and validation that you may or may not have. And so we want to make sure we support you through that process. The application office hours, we'll distribute a link to schedule time with either me and or Darby to talk through your application. I really love doing this with different companies. I love trying to help people figure out how to position themselves and set up really a pilot for long-term success. And so that's really what I look at in the application is how can you position the pilot such that people are likely to say yes to it, and something confined enough where if you succeed in the pilot, it turns into a long-term contract. After that phase or during that phase, kind of overlapping, we're going to set up a speed networking event where you'll be able to meet up with different folks in the California and Colorado startup ecosystems to figure out is there different perspectives that you might want to bring into how you're thinking about working within the safety net. And then these are some updated dates. So if you were following along in the past, this may have changed, but we are saying that your applications for the final round are due March 1st. And then we will take a couple weeks to whittle down the 16 to 6 finalists who will be announced at the end of March on March 29th. So based on those applications, we'll work with judges who are, many of the judges are also part of the mentor community. So these are like those people that you're meeting with. These are made up of experts. There are people who work within health systems. They're investors. We whittle that down to 6 finalists, and those 6 finalists will be announced and invited to the summer grand finale event, which we have promises of exposure for your company and hopefully pilots, and through the pilots, award funding to actually pay for those pilots. So that's what's ahead of us. We have not yet scheduled the summer grand finale, so we're still whittling that down to a date and a location. We are really hoping that we can do it in person. Since the pandemic, we've been doing a lot of these things not in person, and I don't know about you all, but I at least have a desire to give hugs, to high fives, to get in person and say hi. So we're hoping to be able to do that. And of course, this being a California challenge, we'll be going out to California for that. Before we move on, as far as the logistical aspects of the challenge goes, does anyone have any questions before we dive deeper into this, just about how the challenge is going to play out?
When exactly is the speed networking scheduled for? You said is it sometime in February or?
Um, yeah, so we have always done like one day that's like a speed networking, 4 or 5 hours, really intense. You meet tons and tons of people, but it's only about 10 minutes with each group. So what we've kind of heard for feedback on that is it would be nicer to it's nice to meet all those people, but it'd be nicer to kind of, get a little bit more time with the people that you want to talk with. So we're gonna try something new. We're going to schedule I think maybe like one per week for like 3 weeks in a row. And just kind of make it a little bit more, maybe like 20-30 minutes in a breakout session with some smaller groups so that everyone can have a little bit more flexibility in their schedule. Um, I think we'll get those dates out to you basically, tomorrow or sometime next week, as soon as possible, because we're just trying to work with our judges on making that change up in the schedule for y'all. But we will let you know within the next week for
Do
sure.
do we select who we will be like speaking with, or do you guys just kind of do something behind the scenes to?
I'm gonna try to get a handle on, and that's why I don't have the dates, because I want to check with who is available on which date so I can get you guys a better idea of like who you would be speaking with at each of those sessions so that you can choose which one is kind of the more important one for you to be able to make it to. You can come to every one of them all the time, the whole session if you want, but I know we're all pretty busy and want you to be able to prioritize which times make the most sense for you. So
Okay. All right, thank you.
thank you.
Cool. We've done some intros, but let's go a little bit deeper here, because I wanted to make sure you know who is here to support you through this process, because as more of these questions come up, or if you have questions that are very specific to your company or your applications, these are the folks to reach out to. So I'll kick it off. I am Niko. I live in Boulder, Colorado. My pronouns are he, him. I have been on Prime Health's board since 2018. And I mentioned that my company Redox did Prime Health in 2017, and that was my first introduction to really the Colorado healthcare ecosystem. My company Redox at the time, I think we had raised our Series A, and were maybe 40 people. So kind of later stage as far as the challenge goes. But after that challenge, we continued to grow. And when I left the company this summer, we had about 280 employees and had raised $100 million in venture capital and private equity, and had really scaled the solution across the country in more than 3,000 health systems and delivery networks and such. And of course, Redox is an interoperability platform. So our customers are actually oftentimes startups. So if you're looking at integrating, Redox might be like integrating with electronic health records, Redox might be a solution for that. I stepped in as interim CEO of Prime Health this summer, or this fall in October, as we really needed to. We had turnover with our prior leadership, who moved on to amazing opportunities, and I really stepped in with that interim role and goal of hiring our next CEO, which I'm excited to share. We announced it last week that Sarah Lamp, who you'll be meeting in future sessions and hopefully at the finale as well, will be starting mid-February, so February 15th. And then I'll be rolling off back to my board seat. So as you see those transitions happen, just know that that's what's going on. And I'm sure Sarah will be excited to meet you all as well as we get deeper into the program. I'll pass it to Darby to do her introduction.
Thank you, Niko. Hi everyone, I'm Darby. I'm the name on all your emails. And I have been doing the challenge and since 2019. I joined Prime Health at the very beginning of 2019. So this is my fifth challenge cycle. Second one in California. Um, I am operations manager. So pretty much I just do all the behind the scenes scheduling and event planning and things like that. I also do the summit, which is one of my favorite events. And I know that some of y'all have made it to that as well. So I'm here for support, answer any questions you have, try to get you all the materials that you need. If there's ever any, you all are very good about emailing with any questions or anything. So I am here to help out with that and just try to keep the process moving. And I'm just really proud with the group we have here of semifinalists this year. I think you all are doing really awesome, innovative work. So I hope you find today valuable and at least a little bit fun. And we're going to try and keep it really interactive and ask a lot of questions and stuff. So feel free to raise your hands and jump in and ask what you need to ask whenever you need to ask it. And I will throw it over to Felicity.
Hi, I'm Felicity. I've been with Prime Health just since August, so relatively new to the team. I am the program manager, so responsible for developing and executing programs and kind of, especially with the challenge, just supplementing and helping where I'm needed. So I'm very passionate about women's health and health equity in particular, so very excited to be on the Prime Health team, and this is my first challenge, but I'm loving all of it so far. And I have a background in third-party pharmaceutical research and public policy. So those are, anyway, the things that I'm bringing to the Prime Health team, and I'm very excited to be here.
Awesome. Thanks, team. Just to give a quick commercial on Prime Health, because it's necessary since this is the Prime Health Challenge. Our mission is to advance health equity through innovation and collaboration. And we can read our vision statement here as I ramble, but really we've done that through the Prime Health Challenge, as I mentioned earlier, matching up supply and demand in the innovation ecosystem around the safety net. We also do that through convening different parts of the community. So we run in-person events, we run virtual events, we run our summit, which is kind of like a conference that we throw every year. That's really the only conference in the country that focuses on the safety net as a place for innovation. As a longtime participant in digital health, I went to the typical conference rally of HIMSS and Health and Health 2.0 back in the day and all sorts of these. But I really, in coming to the Prime Health Summit, really saw the lack of focus in those other conferences on where a large part of healthcare actually happens, which is in our underserved and rural and less privileged communities. And so Prime Health really focuses on bringing that innovation and implementing pilots and accelerating health in those areas. And we do that by working with all these different stakeholders, of course, with the patient at its core, but you all are here as entrepreneurs in this aspect, but we really try to convene different parts of the community. And as a core hypothesis in that, the more that these groups work together and the more that they know each other, the more innovation will actually be implemented. And so a big piece of this is actually just bringing people together to better understand, better empathize with each other, so that we can all work towards that common goal of making that patient experience better, more accessible, more successful. And we wouldn't be able to do that without our partner in the California Challenge, which is the California Healthcare Foundation. And I'd love to invite Janet up to introduce herself from the foundation and tell us more about the work that you all do there, and why this challenge is important to that.
Yeah, definitely. Hi, everybody. I'm Janet Boachi. I will come on camera very soon, but Niko, Darby, we also have a presentation ready for you, but Melissa is actually going to be joining soon. So maybe we could take a moment to take a break, and then whenever we're ready, we can jump in on sharing a little bit more about CHCF.
Yeah, let's actually we can move forward into our introductions, and then when Melissa joins, we can move back to that. So no worries.
Sure, sounds good. Cool.
So this is the part I'm most excited about, is getting to know each other. If you would be so bold when you're making your introduction, if you want to turn your camera on. If not, that's totally fine too. But we'd love to see your shining faces. And we're gonna, since we have about 30 people in this group, it's gonna have to be pretty quick. So like less than a minute, but who you are, your pronouns, your location, and a brief description of your company. As a founder myself, I know how difficult it can be to share a brief description, but I would encourage you to try, so we can get through everybody. Beyond these introductions, so this is just setting the stage so everyone can get to know each other a little bit. Beyond this, we're actually going to do breakout groups. So we'll probably save that for after the CHCF presentation, but we're going to break into groups and match you with people so you can go a little bit deeper on what your company is, what you're focused on, what the challenges you face ahead of you are, what you're excited about, things like that. And so we'll have a little bit more time to go deeper so you can build more one-on-one relationships. But let's get going here. I'm going to call out individuals to come off mute and do their introduction to sort of keep us on. And I'm just going to like literally go down the list here. I might forget people by the end, so I apologize if that happens. But let's see. Ariana McGee, would you be willing to go first for us?
Sure. Hey guys. Hi. Ariana McGee. I am the founder and CEO of Navigate Maternity. I'm actually was on the treadmill while I'm listening. So so health is wellness, or wellness is health. We are a tech-enabled medical device company. Our flagship product is our remote patient monitoring system. We are primarily focused on serving underserved populations. We have a great team, been in healthcare for the last 12 years myself, come from the reimbursement, market access, medical device space. I'm so excited to be part of the cohort. Thank you so much. And Thea James, our COO, is also on the call.
Awesome. Do you want to go right now, Anthea, to just build on that?
Yes, I'm sorry, and I'm over here making lunch. I'm in the South. I live in Atlanta, so it's lunchtime for us. But yes, as Ariana stated, our product is a maternal product. So we have software and hardware, and it's monitoring mothers throughout their prenatal as well as their postpartum journey. But yes, I look forward to everything.
Awesome, great meeting you, Thea. Up next, I have Ashley Kirk.
Bill, did you want to go instead of me? Sorry.
You should go. Go ahead. I can go after you. Yeah.
Hi everyone. Let me look back at the chat. Sorry. I wanted to see what I was not expecting me to go. Sorry.
No worries.
Hi everyone. My name is Ashley Kirk. I'm the Director of Business Development at Rocket Doctor. I'm located in Atlanta, Georgia as well. We are a platform and marketplace that integrates AI-fueled technology to match patients with the best providers possible in their care.
Great to meet you, Ashley. And then Bill, did you want to build on that? It sounded like you guys work together.
Yeah, I'm the founder and CEO as well, but thanks, Ashley. That was great. Did a great job. Hi, everybody, and some familiar faces. Niko, brief connection in Boulder with Katie at Moxie Ventures, but yeah, my background's in emergency medicine and public health, and 10 years ago in the nonprofit sector with a group called Bridge to Health Medical and Dental, but founder CEO of Rocket Doctor. As Ashley said, basically a Shopify for providers, and then helping to match the right patient and provider, but focused explicitly for folks on Medicaid and in rural and remote communities. And we've now provided care to over 300,000 patient visits with more than 300 physicians, and growing every day.
Awesome. Great to meet you. And does that round out the Rocket Doctor crew that's here today?
Yes.
Awesome. Great. So let's, Colby. Nice to see you, Colby. Are you ready to give a quick intro?
Absolutely. Hey, everyone. Colby Takeda, co-founder and CEO of Pear Suite. We're building a care navigation and billing platform for community health workers and promotoras and health representatives and even doulas in California, helping them better connect with health plans and bill through some of the new benefit programs. From Hawaii originally, but based in airports now, pretty much. Pronouns are he, him, and excited to be here. Thanks, everyone.
Awesome. And Colby, was there anyone else from Pair?
Not right now. I think my colleague Andrew will be joining later, but just me for now.
Gotcha.
Thanks.
Awesome. Who else do I got here? Decca. How do you? Yeah, Decca. Am I saying that correctly?
Absolutely. Deca
Awesome.
DK.
To meet
You got it
Decca.
right the first time. Yeah. My name is Deca DK. I'm the CEO founder of Amatochi. We're a health tech company focused on seniors. We built a solution that allows seniors to stay at home longer safely, help combat social isolation, help meet their physical needs. We recently started working with 4 of the biggest Bay Area counties, which is amazing. I'm based in San Francisco Bay Area. Happy to be here. And congratulations to all the semifinalists.
Awesome. Great to meet you. Was there anyone else from Omatochi here?
No, just me.
Okay. Great. Welcome. Desby.
Yes, Desby was correct. Thank you, Niko. Hi, everyone. Desby McDaniel. I'm co-founder and CEO of CliniSpan Health. My pronouns are he, him. We are helping pharma companies maximize the power of social media with an AI-driven influencer relationship management platform. So we are working with influencers in the clinical research and clinical trial space to access underserved patients. Happy to be here.
Nice to meet you, Desby. Is there anyone else from your team here?
There is not. There may be someone joining a bit later. We'll be in cycles.
Awesome. Sounds good. Next up, I have Erin Spalding.
Hello, I'm Erin Spalding, she, her. I am currently in Kalamazoo, Michigan. Most of the Metacypher team is in the Colorado area. Metacypher specializes in solving inefficiencies in nurse scheduling. So we have a software tool that automates nurse scheduling using operations research-backed decision support in helping those managers really decide how to schedule their nursing resources to best meet patient needs and to place their nurses in the best position to care for their patients, while also, optimizing the safety of the patients and reducing labor costs and promoting a healthy work environment for those nurses. So we're very happy and excited to be here, and congratulations to everybody else too.
Great to meet you, Erin.
Nice to meet you too.
Was there anyone else from the Metacypher team on the line that you want to?
No, our CEO will be joining later today, Stephanie. So just
Cool.
me right now.
Sounds good. Frank Russell.
Good afternoon. I'm going to defer to Dr. Kathy Kim. She's our project leader.
Hi, I'm Kathy Kim. I'm the founder of Activate, which is actually a spin out from the MITRE Corporation and University of California, Berkeley. So we have a pretty large team on our call today. But Activate was co-designed with family members, patients, and community health centers in rural California to fill the need to optimize both staff and operations for care coordination of people with chronic illness. So we've demonstrated our solution can deliver improvements in hemoglobin A1C and blood pressure for those with diabetes and hypertension. And we are now trying to take that to the market so that we can help many more clinics throughout California and across the country to do that. So I'm she, her, and we have from the MITRE side, Frank and Melissa, from the Berkeley side, Scott, and then 2 new team members, Tyler and Kim. So if you want to go in that order.
Yeah, go for it.
Frank.
Hello, Frank Russil. My pronouns are he, him. My location is Shrewsbury, New Jersey. And basically I'm a principal software engineer doing the technology development for Activate.
Hey everybody, I'm Melissa Valenzuela, also at the MITRE Corporation with Kathy and Frank. Pronouns are she, her. I'm located in Ann Arbor, Michigan, and I'm a program manager for the project.
Nice to meet you.
I think it's up for me next. Hi, everybody. My name is Scott McGrath. I am a project manager for Activate. I work at Citrus Health, which is actually within the UC Berkeley system. And my background, I got my doctorate in biomedical informatics. And I'm actually calling in from Missoula, Montana. So I'm 100% remote. Pleasure to see everybody.
Nice to meet you, Scott.
And Kim?
Hi, I'm Kim Harris. I'm excited to be working with Kathy and the team on Activate. I'm here in New York City, but a Denver native and spent a lot of time in California. So some of my favorite places and a lot of my favorite people. Congratulations to everyone. And this is fun to be part of. Thank you.
Awesome. Nice meeting you, Kim.
And Tyler. We might have lost him. I saw him on earlier.
No worries.
You can go ahead. Thank you.
Yeah, thanks. Excited to learn more about Activate. It's sort of like a non-traditional company as far as, not your traditional startup, but as a spinoff. So that's awesome. We're getting to the point in the list where I'm probably going to end up skipping people or calling people who have already done intros because my list moves. I didn't realize. But this next one, I don't think we've heard from yet. Gorang, is that how we say it?
Yeah, Garang, you got it. Hi, everyone. I'm Garang. My pronouns are he, him, based in New York City. Founder and CEO here at Violet. Personally, really mission-driven. I grew up on Medicaid for many years. I'm a gay man. Built a health plan called Oscar for many years, so got to see just firsthand how much there is a need for quality, inclusive healthcare. At Violet, we essentially are building infrastructure for inclusive healthcare. So we work with health plans and health systems to measure how inclusive they are. We upskill them with clinical education, and then we use the data to build better relationships. Excited to be here.
Awesome. Great meeting you, Garang. And was there anyone else from Violet here?
It'll just be me this morning.
Great. Cool. Next up, did we hear from James already? James Lott?
Hey, good afternoon, everybody. I'm James Lott. I'm in Chicago, co-founder, CEO of Scripted. Scripted enables pharmacists to provide direct patient care amidst the looming physician shortage. We're going to be short 134,000 physicians in the next decade, so got to do something about that. Really excited to be here and enjoying here all the cool solutions. Thank you.
Nice to meet you, James. And then Kike, is that how you say it? Kike?
Yes, my name is Kike. I'm Kike Oduba, founder and CEO of Wellness Wits. Wellness Wits is a digital health platform for shared medical visits. We're trying to solve the problem of physician burnout and also help consumers who have chronic diseases connect better with their doctors and care team members to improve their adherence to care plans. So we're helping people in underserved communities with conditions like diabetes, hypertension, maternal and child health, and also rare diseases that are very dependent on people following a specific care plan based on their health literacy. Happy to be here, and congrats to everyone in the cohort.
Nice to meet you, Kike. And then Kim, I think we've heard from one Kim, but it seems like there's two Kims.
There's a Kathy Kim and a Kim Harris. We introduced ourselves. Is there another Kim?
Nope.
Okay.
What about Kwamani? Is that how we say it? Kwamani?
Hey there. It's Kwame.
Kwame, sorry.
Kwame Liddell here. I'm the founder and CEO of ThriveLink. We build AI social workers that sign people up for things like health insurance, utility assistance, food stamps, things like that. My background, I'm an ER nurse. I was a healthcare lawyer. So I saw in hospitals and in the health plan side how the paperwork that we require people to do to access programs is one of the largest barriers. It's actually the reason 90% of California Medi-Cal members lost coverage last year. So we're allowing patients to skip that paperwork by just talking to a device as opposed to having to read things. And I'm here with Yesenia, who leads our clinical and patient experience team. I'll let her introduce herself.
Hi.
She might have. Oh, go ahead.
Can you guys hear me?
Yep, we got you.
Perfect. My name is Yesenia. I'm here with Pauline. I lead the care team, and my job is to ensure that the patients that start an application cross that finish line.
Awesome. Great to meet you both.
Thanks. Likewise.
And then Melissa Valenzuela, have you introduced yourself yet?
I did with the Activate team.
Ah, great. And then what about Pitts? Pitts, are you with us? Well, if you are, come join us whenever you you get your audio back. Ryan Young, you're up.
Hello, everybody. My name is Ryan Young. I'm an MD MBA. I'm based in Buffalo, New York. I'm founder and CEO of Apollo Technologies, which is a fintech healthcare AI company. Our flagship product is the Apollo ecosystem, which is comprised of two components: Apollo, which is an AI algorithm that provides more accurate surgery duration forecasts in minutes, and the Apollo Exchange, which is a marketplace for facilities to sell the time that they freed up with the more accurate Apollo forecasts to insurers or payers on the exchange. We also have this derivatives component, which is kind of like 2 steps ahead, but it's overall general of the company. Super excited to be here and really get to hear and learn about like all of you guys' great companies. So thanks again, appreciate it. And and only I'm on the call for today. So
Awesome, good to see you, Ryan.
Good seeing you.
And then Sana, I don't think we've heard from you, right?
No, not yet. I'll undo my video and video. 1 second, sorry.
No worries.
Okay. Can you see me?
Yep, we got you.
All right. So my name is Sana Gaspard. I have my doctorates in biomedical engineering with a focus on medical device development and commercialization. And I'm the CEO and founder of Rubidetection. Rubidetection is working on developing an AI-enabled platform, which includes a hardware-software component to monitor chronic skin conditions, so chronic dermatological conditions like psoriasis, acne, potentially skin cancer, as well as chronic wounds like diabetic foot ulcers, venous leg ulcers, as well as those surgical wounds, to do early detection and data-driven care personalization, as well as enable remote patient monitoring. So we increase the accuracy of the care, we increase access to care by helping people do remote monitoring, and we help optimize care planning for the condition to reduce costs.
Awesome, great to meet you, Sana. And then it looks like, is it Yannick is also here from your team?
Yeah, so Yannick is our VP of Data Science, so I'll let him introduce himself.
Hi, my name is Yannick. So I've been working with Rubidetection, and like Sana said, I'm the data scientist with Rubidetection. My background is in chemical engineering. I have a PhD from the University of Pittsburgh, and my work at Rubidetection consists of developing the algorithms and analyzing the data from the device. Nice to meet you all.
Yeah, nice to meet you, Yannick. Who have I missed? Who hasn't introduced themselves yet? And Melissa, we're going to save you for your presentation that you'll give after, so you can pause on that. But anyone else that is on the call who hasn't had a chance to say hi?
Hi, Niko. It's Marguerite. I haven't gone yet.
Oh, hi, Marguerite.
Hi.
Sorry, I missed you there.
No, it's okay. I'm Marguerite Pierce, co-founder and COO of She Matters. We are a digital health platform designed to support Black women who experience postpartum comorbidities. And we do that in a few different ways by providing them access to culturally relevant resources, access to culturally competent healthcare providers, as well as access to community. We also train healthcare providers on how to be culturally competent in an effort to improve the relationship between provider and Black mom to ultimately improve the healthcare outcomes for Black mamas. Lastly, we are in development, really excited about this, for a postpartum symptom tracker. This will allow us to assess the risk for Black women who might be susceptible to high blood pressure related conditions such as eclampsia and HELLP syndrome. So happy to be here.
Great to meet you. Okay, who else hasn't got to say hi yet? Okay, that was your chance to be included. I'm just kidding. We'll have more opportunities to chat through the rest of the day.
You can now forever hold your peace. Just kidding. Jump in later. It's fine.
So with that, now that we have a little bit of baseline of who's in the room, I'd love to invite Melissa to share more about the California Healthcare Foundation, if she's here. I saw her earlier, and you're welcome to share your screen as well.
Hi all, it's Melissa Buckley, and I'm actually here with Janet Wachi, who is the commander of any slides. Janet, are you?
Oh yeah, there she goes.
Yeah. Okay, good. So we just quickly wanted to say, we know many of you well, and it's great to see so many familiar faces and so many new folks that are working on solutions that are, dear to our heart and related to what the California Healthcare Foundation cares about and works toward. I'm gonna just start us off, and then Janet's gonna take over most of the presentation. So I will do that. Janet, next slide. This is us. I'm technically the director of the Innovation Fund at the California Healthcare Foundation, and Janet is our Health Equity Fellow on our team, which is an impact investing team. Next slide. So for folks who have never heard of the California Healthcare Foundation, just high level, our mission is to improve access to care and quality of care for Californians, particularly those with low incomes and who are served by our Medicaid program, which is called Medi-Cal. We do that, so we're an independent foundation. There are a number of foundations in health around the country that you might run into that are called conversion foundations. So when you guys are all younger than I am, but in the 90s, a number of the nonprofit Blue Cross Blue Shield plans and other insurance companies that were nonprofit converted to for-profit status to compete with commercial providers or commercial insurances. And the value of the tax benefit went into a number of foundations, including ours. So we sit on with the market up and down. I think it is probably closer to 850, but between 850 million and $1 billion of assets, and we make grants off that corpus. And those grants were what's called a strategic foundation. So we have strategies that we believe will move the needle on access. And we invest in those strategy areas over a number of years. And so our grant makers, my colleagues, become sort of deep experts in those areas. And they include things like healthcare workforce, improving care and care coordination for folks who are facing housing instability, maternal mental health and Black birth equity, telehealth, various kinds of strategies that sort of generally endure over time and are pointed toward improving access. Janet, next page. Janet and I live in that ecosystem, and we run basically an impact fund within it. We are in sort of what we call impact investors is relevant to you in a couple ways. So we invest in order to achieve the impacts that our colleagues and we care about, so improved access. We care about financial returns, but only from the perspective of achieving scale. So we're a small foundation. We care about all of California, which is a large state. And we're really looking for innovations that work to improve care in the safety net and serve all of California. So it really scale and growth are critical to us. And we believe in this hypothesis that we need other investors' money to sort of accomplish that. So we care about financial returns and sustainability for the purposes of being sort of a proxy that other people invest in, the good solution and good things that work to improve access, grow and spread. So other mission investors that you might run into over time care about mission, but their primary outcome is financial return. Some folks sort of have those things sitting side by side, and our objective is to improve healthcare. Next page. This is our team. This is our direct team. You may run across any of us in conversations together. It's Janet and I, our direct colleagues, Stella Tran and Vanessa Verde, our communications officer, Ilza Martinez, our grants administration guru, James Pecor, and then those of the senior team at CHCF, Sandra Hernandez, Cara Carter, and Tai Kim. Next page. We also gather folks around us that sort of support us more deeply or in ways that we don't know. So we have an advisory group of traditional healthcare venture capitalists, so you can see at the top, who answer questions that are more related to investment structures that we sort of don't spend as much time as they do on. And this group of subject matter experts that we work with, we have a different sort of cohort every year, and you will hear from some of those folks later today, but they tend to be deep in the delivery system, either working in large provider organizations, payers, sometimes policymakers, entrepreneurs who have scaled companies in the past, folks like that. Next page. And this is the last page I will do, and then I'll transition to Janet. Equity is the heart of what CHCF is doing in the world. We serve the Medicaid communities in California, and those communities are mostly entirely people of color. We have a significantly sized Latinx community in California, and along with all sorts of other people of color and women. So we are really working to make sure we have diverse folks as entrepreneurs leading these solutions. We think that's important because of the authentic voices that are necessary to champion these solutions and talk to sort of the end users and connect with them in the ways that others can't, and for the insights that folks bring when they grow up in the communities that we're trying to serve. And with that, I will hand it to Janet to say a little bit more about how we work specifically. Janet.
Well, yes, thanks, Melissa. Hi, everybody. Good to see some familiar faces. Really great to see some new faces. Congratulations on being semi-finalists. So I know some of you may have already been familiar with CHCF, but for those who don't know, I would like to see CHCF Innovation Fund as kind of a bridge. Pretty much we bridge Medicaid payers and providers and mission-aligned entrepreneurs because California is hard. Entering California is very difficult. So typically what we try to do is do our best in making connections and kind of talking with our partners on the ground about a lot of technology solutions that exist out there in the world. And then also in change, when we talk to entrepreneurs, we kind of share with them what's happening in California, what's happening in Medi-Cal, what are some payers and providers thinking about. And so we usually like to do that bi-directional learning. So Melissa tapped on this a little bit earlier today, but typically when we make our investments, we like to align strongly with our focus areas. Melissa named a few, just to highlight a couple. We focus on Black health equity, Latino health equity, care for people with complex needs, specifically homelessness and older adults. We do behavioral health transformation. We focus on workforce and workforce pipeline, just to name a few of some of our focus areas that Melissa already mentioned. So the Innovation Fund has been around for quite a while, and we've made investments in more than 30 to 35 companies ever since the Innovation Fund was created. This is a list of our portfolio companies, but there are some portfolio companies that have yet to be added. And so we're really excited to be partnering with some seed and growth stage companies. So the portfolio companies that we have currently have a lot of impact. They've deployed technology in about 250 California hospitals. They've served 5 million Medi-Cal enrollees in 49 counties, partnered with 100 community health centers, and they've done really well with working with CHCF. So we're really excited to see the impact that the portfolio companies have had. So in summary, the Innovation Fund acts as a strategic investor for early through growth stage health solution companies. We provide both capital and network building support to entrepreneurs. We can bring deep knowledge and policy and our delivery system partners and reimbursement within Medicaid in California. And we vet solutions to some of the most persistent healthcare challenges amid a complicated landscape. And then also we support plans and providers by offering grants for pilots, startup expenses like EHRs, integrations, project management, and outcome evaluation. I feel like I'm missing something on the bottom, but I'm gonna move on to the next slide. And so typically what we look for at CHCF, we like to see a clear need and interest among California Medicaid payers and providers. We want to make sure that each entrepreneur that comes across our table and each company fits with CHCF's mission, especially with a focus with California Medi-Cal, those who are typically overlooked in California. We do expect a financial return, but we prioritize impact at scale a lot more. Traditionally, the fund has focused on Series A through C, but in 2021, we expanded into providing capital to seed stage companies. We also like to see a traditional investor in the syndicate. And then, we'd like to also do evaluations and publications. If you see on the CHCF website, if you want to see any kind of information on what's happening on Medi-Cal, the CHCF website is amazing. We have a fantastic comms team. And then also we typically like to see founders and entrepreneurs in general that have lived experience within the community. And then also, especially with our seed stage work, we like to focus a lot on Black, Latinx, and female founders. So typically, in terms of our investments, we go up to $250,000 for seed, and then 1 million to 1.5 million for growth stage. We're pretty flexible in our investment structures. And then for growth stage companies, we typically provide a grant to a partner on the ground for adoption, scale, and evaluation. And then typically for us, we usually like to align our investments again to our strategic priorities of our grant makers. So typically kind of shy away from life sciences and medical device companies. So what is CHCF's role with the Prime Health Innovation California Challenge? So we're super excited to be working with Prime Health for a second year in a row. We're happy to bring a lot of our subject matter experts, as you'll meet some of them later on today. And then also, if you do have any additional questions for us, please feel free to reach out. I think we have maybe about like a minute or two for questions. So if anybody has any questions to ask myself and Melissa, feel free to jump in.
I have a quick follow-up question. Thank you for that great overview, both from you and Melissa. I wanted to know 2 quick questions. What is the investment process for the California Health Fund? And how is it different from the Prime Health Challenge? And then the second question is, what if you guys are focused on health, why do you not also invest in life science and medical tech? Or medical devices, hardware?
I can start. On the second one, it's easy. We have no expertise in that area. And so the thing that we do well, I think, is not the money and capital part. We actually don't have a ton of money. We just have these folks that understand the delivery system and the reimbursement structures in Medi-Cal, and we are trying to leverage them to help scale innovations that make a difference. And life sciences is just a way out of our zone of expertise. We don't know anything about the regulatory process. We don't know anything about science, blah, blah, blah. So that's the answer on that one. The investment process, this is part of it. We are out there in the world just learning about what companies exist in the world and what they're focused on. And simultaneously, we're working with the plans and providers and understand deeply what are the problems they're trying to solve. And when we find a really good fit, and we talk to our stakeholders who are excited to partner with and contract with a company that's a healthcare startup company, we sort of try to lean in to support. So it's kind of a get to know you process. It's not the traditional either accelerator process or venture capital process. It tends to be, to Janet's bridge analogy, if there's a bridge that's being built and that we can help build, and we can sort of look to support that connection more substantially than we have some investment capital to add.
Okay, thank you for
Actually, and I'm gonna let Janet take the rest of the questions. I misjudged our timing here and have a board meeting to join at 10. So Janet, God bless you.
Yeah.
Nice meeting everybody. We're around.
I'm gonna leave too.
Nope.
I just want to say hi to Melissa.
Hey guys,
Thank
great to see everybody. Love you, Gil.
Gil.
You too. Hey guys. Hi and bye.
Go away, bye. Okay. But anyway, I know that it's already 10. It's already 10. So if you have any other questions, feel free to send an email to me. My email inbox is a little full, I'm not gonna lie. But definitely just say Prime Health Innovation Challenge in the subject line, and I will get back to you with any questions. I will go ahead and drop my email in the chat.